Esteban with Denver A.
Teresa, it's Ed C. Lover with the Denver Business Journal.
Erica Meltzer from Chalk Beat.
Seth Klayman from the Denver Gazette.
Hi, Teresa. This is Vinny at Bloomberg.
Hi, Vinny.
Chris Vanderveen with 9 News.
Thank you, everyone, for joining us this morning. As many of you already know, last night we received a notice from the Colorado Department of Public Health and Environment that due to the dramatic rise in our average daily case rates, positivity rate, and hospitalizations, Denver will be moved backwards to the state's dial system to safer at home level 3. Colorado Department of Public Health and Environment has been a tremendous partner and has helped to advise Denver along the way. The level 3 capacity restrictions are now in effect in Denver. We are ordered to complete the transition by Wednesday afternoon, and we will work to implement this state order in the best way we can to protect our residents and mitigate the impacts of our hard-pressed businesses. The numbers are the numbers. They don't lie. We've all seen this similar resurgence of infections across the country and frankly across the world. This is what we get when we don't have a national strategy where we're piecemealing the approaches, where states like Colorado took this seriously and others took the approach similar to what our leadership in Washington has advised, pretending that there was no pandemic. And the story, had we followed science, had we all worked together on a national strategy, the story might be different today. Despite our best efforts and the fact that most Denverites are dutifully wearing face coverings, practicing social distancing, postponing family gatherings, and otherwise making sacrifices to keep our community safe, Denver is not an island. We're the capital city, the largest city of the state, visited every day, and we cannot control what our near neighbors and others may be doing when they visit our city. I don't believe this is Denver's failing. It is rather failing by those who still refuse to believe in science and those who do not take it seriously. Here's what the compliance with the state order means to us here in Denver. Restaurants, retail businesses, and offices will have their 50% capacity cut in half. Indoor events now have a 25-person cap, and outdoor events have a 75-person cap. These are just some of the capacity limits that are back on for Denver. To get back to level 2, we must reduce our average daily cases, positivity, and hospitalization rates back to levels allowable for it, and then hold those reduced numbers for 2 weeks so we could be, it could be a little while before we're able to be upgraded. I want to be very clear. This does not impact vote centers. Vote centers are safe. We're asking everyone to wear a mask. In fact, it is required, and that you social distance when you show up to the vote centers. Here's what I hope every Denver resident will hear from us. If you contract this virus, at that moment, you have no way, zero, of knowing if you will have mild symptoms or if you will end up being put on a ventilator in the ICU. If you catch it, you can still spread it to others, even if you're asymptomatic. And you have no way of knowing, absolutely none, if those people will just get mild symptoms or, again, end up in the hospital right alongside you. These are not political words or political posturing. This isn't fear-mongering. That's just how the virus works. We don't know how it impacts individuals. And the people who are making this about politics, who are willfully ignoring the science, thinking it's not going to happen to them, going about their day because they think it isn't a big deal. This is the result that we see. The wave, the peak, the rise, impacting lives, putting people in danger, and again, impacting our economy. Since March, we've all been working hard, pushing a boulder up the hill, slowly, making progress, getting back to normal. And it's taken every one of us to make the progress that we've seen. That boulder has just rolled back on us because some people have decided that they didn't want to push anymore. A lot of people have put in a lot of hard work and made a lot of sacrifices to suppress the spread of the virus in our community. Folks have put a lot of the aspects of their daily lives on hold to help get this virus under control. Businesses have faced a lot of hardships, bordering on going out of business altogether to keep their doors open. I've already heard from some of those business leaders. Families' health have been at risk. People's livelihoods are at risk. Our kids' success in school is at risk because some people didn't take this situation seriously. We all have to step back now. If we're going to make it through this, if we're going to get anywhere close to normal in the near future, we all have to take on the responsibility to help make it happen. We can get this thing back under control, but we're going to have to take more of a serious approach to doing it. Get back to the fundamentals that helped us to get that boulder up the hill. Thankfully, as one bright spot in this order, the variances that have been granted by the state for capacity at things like our arts and cultural institutions, those will remain in place. And now I'm going to turn this over to Bob McDonald, our director, who's been working very feverishly to help save the city, to talk more in depth about what this order means for Denver and what we all need to do. Bob?
Yeah, thank you, Mayor. I want to thank everyone who's able to join us this morning. I'm going to share my screen here and kind of go through some slides, give an update on where we are. So here's where we are at this point. This is a curve, the epi curve. I know that many are familiar with this, and you can see how this virus has responded from day one. We saw the first spike in May, and you can see what the case numbers were at that time. And then shortly after July, we saw another spike. And now we are up here at a cumulative incident rate, a 2-week period of 385 cases per 100,000 in this city of Denver. We need to get down to 175 cases per 100,000 for a 2-week incident rate. So you can see the work that we have to do here to get back to where we were before this level that we're in now. You see this little dip here at the end of the epi curve. That's just a delay in reporting. That is not an indication that it's starting to move in the right direction. In fact, all indications are that it's going to continue to increase unless we all pull together and do everything that we can. When you look at the state's dial, any one of our citizens, any stakeholder can look this up, just CDPHE dial, and it's going to take you to this, the metrics that the state health department looks at to determine where local jurisdiction should be. And I want to point this out right here. This 384.6 now cumulative case rate for a 2-week period, and we need to get down to 175. I want to point out here that with respect to that metric, that single metric, we are already moving towards a stay-at-home order if we don't get this under control. You can see that the other two metrics here are trending in the wrong direction, along with our cumulative case rate. So we have a lot of work to do together, and we can get there, but we need compliance, and we need to stop looking at this as just the flu. And I'm going to talk about that in a minute. So what is different here? When we saw the high case rate back in March, and then after the holiday in the middle of the summer, we didn't have the high positivity rate that we have now. We're seeing an increase in all age groups versus just the older population early when the pandemic came to Denver. We are seeing hospital admissions go up, ICU capacity is diminishing, and so we need to get on this and get on it quickly. I want to talk a little bit about the positivity rate. I hear this question over and over again. Isn't the positivity rate going up because you're doing more testing? And that is absolutely not accurate. The positivity rate is going up. The more testing that we would do, generally you would see the positivity rate go down because we're testing more people who do not have the virus. But that is not what we're seeing. Early on in March, and as we increased testing, we saw the positivity rate do just that. It was going down. But now with increased testing, it is actually going up. So I want to dispel that idea that with more testing, you would see the positivity rate go up. That's only going to occur if you have more incidents of the virus in our community. I already mentioned that we're seeing an increase in all age groups. You can see here that the highest percentage of those that are tested as positive continue to remain in our younger population. Those that are in their 20s and early 30s. And I want to reiterate something else here, that if you are in that age group and you're not concerned about wearing face coverings because you think that you will withstand the symptoms of this virus, remember that you can carry it to many other people who will not do as well. You may not even know that you have it, and you can still spread it to others if you're not following public health controls. I mentioned earlier what's different with what we're seeing now versus what we saw earlier in our course through managing this pandemic. In early March, you saw that hospitalizations were up, primarily due to the fact that we were seeing the older generation being impacted here, and they don't withstand the symptoms of this virus as well as younger people do. And then look here, after July, we saw hospitalizations rates go up. But if you look at where we are now, case rates are going up, and hospitalizations are going up as well. We are on this track right here, where hospital systems could become overwhelmed in the next couple of weeks. It could happen that soon. So we need to turn this. We need to turn this around quickly here. This has to stop. For those of you who might be in this, doing things that. Like we see in this picture here, that this has to stop. We have done everything we can to enforce compliance. In these types of settings, it's very difficult to do that. This was not a picture that was taken pre-COVID. It was not a picture that was taken in March or April or May. This was a picture that was taken and sent to me to this department last week. This type of situation here has to stop. We need to, all of you, younger adults, please distance, please wear face coverings. Remember that not everyone recovers easily. It's not just the older demographic here. There's a whole list of things here that people could be experiencing where this virus could be very, very harmful to them, if not create more fatalities. And people with these conditions, with some of these conditions, may not even know it. That they're experiencing these conditions. So we all need to be respectful of everyone else to get this under control and to make sure that we're not spreading it to people who may not withstand it as well as others. I hear people say, this isn't any worse than the flu, or there's the mentality that, I've had the flu before, I'll be okay with COVID-19. Let's get the record straight here. The differences here. You can see that what I've laid out here, some of the differences on how the flu generally can come on pretty quickly, where with COVID-19 comes on a little bit slower. And just take a look at the death rate. This is 2019 data, as many as 62,000 deaths. Where we are at right now, just in this country, 225,000 deaths, over 225,000 deaths with influenza. Hospitalization rate is about 69 hospital admissions per 100,000, where it's far more than that with COVID-19. Symptoms with the flu are a little bit more common, easier to identify, not as asymptomatic, where with this type of virus, many, many people can be asymptomatic. So back to this idea of those who think they'll do okay if they get it. Remember, you could get it, be asymptomatic, and give it to people who are struggling with many of those things that I had on the previous slide. In my 30 years in public health, I don't know if I've seen anything that a transmission of a virus or bacteria that spreads as easily as this one does. Face coverings work. They work. So whether you believe them or not, believe in the science or not, we need to be doing that. We need everybody. Every citizen needs to contribute with wearing face coverings. We can turn this around, but again, a high level of compliance is absolutely necessary, 100% compliance, and we can turn this around. Everybody needs to do their part, and if we do that over the upcoming months, before we get to the holiday season, we can be in a much better situation if we all comply. And with that, I'll stop and turn it back over to Teresa or the mayor.
Thank you, Bob. Again, as we prepare to close, I just want to remind everyone, gathering in spaces not currently under capacity restrictions are limited. If you're with other people who aren't your family, you must wear a face covering, whether you're inside or out. And if you're a business, if your business falls under the new capacity restrictions, please take steps now to meet those requirements. Our Department of Public Health and Environment will be increasing enforcement of these activities that are prohibited under city and state public health orders. Our tolerance for violating the public health orders will have to be, unfortunately, very limited. And they have to be because this is about saving lives, as Bob has pointed out. Let me reiterate again, the election will not be impacted by these restrictions put in place today. We encourage voters to vote their mail ballot at home and use one of the 24-hour drop boxes or drive-throughs around the city to drop off their ballots. After yesterday, it is too late to mail in your ballot. You must drop it off now. If you need a ballot, the clerk and recorder offers curbside pickup at designated locations. Again, we encourage people to go to denvervotes.org to find out how you can obtain a new ballot if you need one. If you have never received one, that website should help you. If you want to vote in person, vote center and polling centers are open from 8 a.m. to 6 p.m. all this week. And voters should wear a mask and practice social distancing when voting in person. We'll go ahead and stop there and open it up for question and answer. I'll turn it over to you, Teresa, to facilitate us.
All right, Mayor, thank you so much. Since I can't really see you, I'm going to ask that you just take turns. So if someone wants to get us started.
Hey, Teresa, Vicente with Fox 31. Mayor and Mr. McDonald, do you know what the main problem is here? Is it small gatherings, lack of masks, schools? Is there any one place that we can pinpoint where the biggest problem is? Thank you.
Yeah, thank you for the question. It's a great question, and I think if we could pinpoint it, our job would probably be a lot easier. I mean, there are some things that we know, and every step of the way, we've tried to target our public health controls so that we have lesser impacts where we don't need them. For example, a number of weeks ago, we were seeing a lot of outbreaks, a lot of cases stemming from post-secondary settings, both on campus and off campus. And our public health control that we implemented at that time, there were many, but it was targeted towards universities. What we're seeing now is a decrease of cases stemming from those, and it's more general. All venues can contribute, restaurants, park settings, backyard settings. We can see cases from all of those settings. And so we need to comply with regardless of where we are. This new order stemming from the state here is geared towards addressing all of those venues where we can see cases. We're going to continue to try to target our public health controls, but it's very generalized now, which makes it a lot more difficult, and all the more reason for everybody to comply regardless of where they are.
Cindy, thanks. Next question, please.
This is Sonia with 9 News.
Sonia, go ahead.
It's just a quick question. I wanted to ask, given Halloween weekend, are there any rules that you want people to keep in mind? Will there be trick-or-treating? Will there not? What will be the rules?
Yeah, we've put out a lot of guidance for Halloween. But before I go into talking about the specifics of that, if we can do things safely, let's try to keep doing those things that we can do. There's a real behavioral health component to all of these restrictions. So if we don't have to restrict something, if we don't have to prohibit it, we want people to still engage, and that's the case with Halloween. That being said, let's do it safely. Okay, if you're going to take your kids out, just take your kids out that are in your household. Don't go out with your neighbors. Don't go out with kids. Don't go out if you're with other kids. Certainly don't participate as a trick-or-treater or as somebody who's handing out candy at the door. If you've been sick or anybody in the house has been sick recently, wear face coverings. Just the Halloween mask, if you will, is by itself is not enough. There should be a face covering under that. So many things that we can do here to celebrate Halloween, but do it safely. And I want to say this is not the time for large Halloween parties for younger adults. Please do not do that. Find ways to celebrate with those that you live with, but no Halloween parties this year in large numbers.
Mayor Hancock, this is
Go ahead,
this is Esteban with Denverite. You mentioned this is, Denver is not an island. can you talk a little bit about, like, are you suggesting that some of these increases are also due from behavior from people coming outside of the city and spending time here?
As I think Bob has appropriately pointed out, it's a combination of a lot of things. But as a capital city, as the largest city, with a lot of the amenities that brings people in to enjoy the city of Denver, when you put that together with the fact that we've seen Denverites really follow a lot of the requests that we've made, the progress we made as the city was shut down, people started wearing masks, they social distanced, they were practicing good sanitizing efforts. All these things helped us to progress. And then as we started seeing more and more folks coming in and out of the city, visiting, which, we want to make sure our restaurants are successful, our bars are successful, our social places are successful. We start seeing some people not following similar patterns and discipline to help us do this. So it's just a lot of the fact that, we are the focal point. We want people to enjoy themselves in our city. We want them to patronize our businesses, but we need folks to trust and believe that, one, science matters, and two, what we're asking you to do is for the benefit of not only yourself, but for all of us who are out there as well. So that's what I'm saying, is that it makes a lot of sense that we would be impacted as the economy opened up, but we need people to be smarter about their engagement in Denver and as well as other places.
This is Eric.
Can I? Sorry, is it my turn?
Go ahead.
Okay. This is Meg Wingeter from the Denver Post. You said about on some of the metrics we're headed toward, we could possibly go toward a stay-at-home order again. So with moving to the second highest level this time, does that then restart the clock? We've got 2 weeks to get the cases out of the stay-at-home range before possibly being ordered up yet another level.
I'll let Bob chime in here, but I want to just tell you from a narrative perspective, a commentary perspective, as a mayor, we want to do everything we can to avoid having to shut down our economy again. And recognize that I believe we've already proven that we can take control of the numbers that we are seeing and reverse them. And that's why we're doing this, is to send a clarion call to everyone that we have a responsibility to once again put our hands on this boulder and begin to push it back up the hill. We can do it. We've proven we can. And in order to do that, or one reason for doing that, is to avoid the absolute decision of, again, stalling the economy or shutting it down. And we want to avoid that as at all costs because of the amazing impact that it has on everyone. Bob?
Yeah, so it's a great question. And you saw on one of the slides that I had shared that the cumulative case rate is in the stay-at-home portion of the state's dial. But that's not the only thing that is looked at. Certainly hospitalizations again, and then positive rate is not at the stay-at-home phase. However, that is climbing. Hospital admissions is climbing. Positivity rate is climbing. But we'll continue to work closely with the state every step of the way to figure out what's the best thing to do at this point. But yeah, that's a real possibility here. If everyone doesn't contribute, I keep saying this, a small amount of non-compliance with public health orders can go a long way with transmission. So every individual needs to comply so that we can drive all three of those metrics down and avoid a stay-at-home order.
This is Erica Meltzer from Chalkbeat. Are you asking Denver Public Schools to make any changes to their plans at this time?
No, we consult with Denver Public Schools. I think the superintendent's done a great job with her leadership team trying to figure out what is the next step. We continue to have conversations with them, talking about potentially going virtual, but that decision has not been made yet. Putting these public health orders onto DPS and other school systems, that those systems are very nuanced. So we are dealing with Denver Public Schools and interacting with them and other school systems separately from this public health order.
This is Tori Mason.
Mayor Hancock, this is
go ahead, Tori. Let's go ahead and take Tori's question, please. Tori, go ahead.
Okay. So variances that have been previously granted will be allowed, something that wasn't eligible under the state safer level 3 guidelines. Is there anything else for Denver that would differentiate from that? For example, will gyms and fitness centers have to go virtual or outdoor groups again?
Mayor, would you like me to address that?
Yeah, Bob, why don't you go ahead and address that?
Yeah, so we're taking a look at that right now, talking with the state health department, considering that particular venue. So I don't know that it's going to be included in all of the metrics or the restrictions that you'll see in level 3. So I think at this point, what I can say is more to come on that. We'll see what decision the state makes along those lines.
Tori, thanks. Who did I step on last time? Was that you, Ed? I don't know who's in it.
Teresa, this is Vinny at Bloomberg. Can
Go
I
ahead,
ask a
Vinny.
question?
Sure.
Yeah, hi, Mayor. This is Del Giudice at Bloomberg News in Denver. As this intensifies, what's the economic impact going to be? Does this threaten the recovery we've seen? Have you been hearing from businesses saying they're just on the line of teetering, et cetera, because of this type of a situation? Thank you.
Yeah, that's a great question. I'll tell you the businesses that I've heard from this morning, those who operate restaurants and taverns, acknowledging the fact that even with our level 2, they were just barely holding on. And so these restrictions are going to be pretty tough. Obviously, their concern is the amount of time that we remain at this level. And hopefully within the next couple of weeks, 2 to 4 weeks, we're able to emerge out of this and get back to level 2, if not even better. So that's their goal. They are concerned. They recognize that we got to do what we have to do to keep people safe. But again, all of this has been devastating to businesses. Nothing trumps saving lives. Trust me, they understand that. I understand that. But this has been a very difficult situation for our small businesses in particular.
Anyone who hasn't
Mayor,
asked a question?
Yeah, Mayor, this is Chris Van Intervene over
Chris.
at 9 News. Do you think that we have obviously case counts are driving a lot of this. Do you worry that there is an over-reliance in the metric on case counts in particular? We're now double where we need to be in terms of incidence rates in the city and county of Denver, and getting down to 175 is going to be difficult under normal circumstances, but we also have an increased testing load, which we didn't see 4 or 5 weeks ago, where we're seeing a lot more testing going on. Do you worry that the metrics make it very, very difficult to go back now that case counts are emphasized so heavily?
I appreciate that, Chris. It's a great question, and I'll say this, and then Bob may have some thoughts on this on a more detailed basis. But one of the things I'll tell you that it's not just the caseloads that we look at, and I think Bob has made that point. We also look at hospitalization rates, and they look at positivity rates over a rolling period of time. This it's a larger picture that goes into all of this, and what we want to avoid is a situation similar to what we saw back in March, where hospitals were being overrun or were close to at capacity, where concerns about the availability of ventilators, and so it's better to get ahead of that curve, and that opportunity we have now that we didn't have back in March, where all of this just fell on us very quickly, and we had this dramatic demand occur with regards to not only cases but hospitalization rates and the run on ventilators and ICU beds. So the reality is we want to try to avoid all that and stay in front of it, because the alternative, along with the flu virus being in the community, could be absolutely devastating, and again could cost a lot of lives and a lot of serious health challenges going forward. So it is not just the cases. There's a lot of, Bob talks about, you may chime in now, Bob, the metrics in which they look at and all the things that help to impact this decision. Bob?
Yeah, so I believe the question was, correct me if I'm wrong here, but is there an over-reliance on this one metric? I don't think so. If there was over-reliance on it, we would have been in level 3 many weeks ago, because we exceeded the 175 limit for level 2. So I think it's, there a lot of thought gone into this decision. I respect the decision. We're going to do everything we can to get down to that 175. And if hospitalizations decrease and positivity rate decreases, but case rates are still above 175. We're certainly going to have conversations with the state health department to see if there's flexibility with that 175 number, because other things are trending in the right direction. So I don't think there's over reliance on it. We're going to do everything we can to get back down there and take it one step at a time. Having said that, it's important to understand that the longer we hold off with public health orders and the more this transmission becomes embedded into our community, the less effective the restrictions will be. So hopefully this will get us where we need to be, and we'll do everything we can from a compliance standpoint to get at those things that you saw on that one slide with large gatherings of younger adults.
Any other questions?
Mayor, I do have a follow-up question. This is Vicente with Fox 31.
Vicente, hang on one second. Yep. Vicente, did anyone else who has not had a chance to ask a question?
Yeah, this is Seth from the Denver Gazette. You hear a lot about COVID fatigue and people just being tired and not, some people being tired, and that's why they're maybe not following some of the public health orders. How big of a factor do you think that is, and what can be done to combat it?
Yeah, good question. I think we all have COVID fatigue, but I liken it to, let's go back to pushing the boulder up the hill. We get tired. It's hard. It's a lot of work. But we've got to push through the tape and get it to the top of the mountain to make sure we're all safe, because otherwise the alternative of that boulder rolling back down on us could cost a lot of lives and absolutely debilitate the economy. There are a lot of folks out of work right now. There are a lot of folks whose lives have been put on hold, who are not going through with normal family activities. A lot of questions about how we're going to observe the holidays, if at all we're able to be together. I absolutely get it. I know Bob gets it. Everyone we're working with gets it. We walk into our offices, we don't have the full capacity of our team in place, present because of what we're dealing with here. Fatigue is natural. Fatigue is an honest response to all that we've been through. This has been 9-10 months. A very difficult time for everyone. But this is not the time for us to stop. We've got to, put our hands back on that boulder. We've got to put our shoulder into it. We've got to fight like hell to take care of our families, our community, and each other, and get that boulder up over that hill and recognize that that's the only way we're going to get back to some level of normalcy, so that we don't have these questions next year, or that by the time we get to Easter, we're not dealing with these type of questions at this level come the spring. Bob?
Yeah, thank you, Mayor. I think the only thing that I would add to that is, when we roll out new public health orders, whether it's at the local level or at the state level, we tend to focus on what we can't do. Because we need everybody to understand where we are and what they need to comply with, so we can drive our numbers in the right direction. But let's keep in mind that people can still go to their favorite restaurant. They can still go for a walk in the park, go shopping, get ready for the holidays. There's still so many things that we can do. Go for a walk down the 16th Street Mall. I mean, just on and on and on. We're not saying you can't do those things. What we're saying is do them responsibly. Do them in small numbers, preferably with your household. Wear face coverings when you need to. Keep the group size small. But there's still so many things that we can do in this city with the great parks we have. There's the excellent restaurants that we have, the wonderful parks here in Denver. We need to focus on what we can do to keep our mental health up.
Vicente, hang with me one second. Jesse or Ed, did you have a question before we let Vicente have a follow-up?
Yeah, I'll go ahead. Jesse at the Colorado Sun. I don't know if we got a 100% clear answer on that. I just wanted to confirm. Level 3 safer at home status requires that gyms shut down their in-person events and indoor activities. Is that happening in Denver? I just want to be 100% sure about that.
Well, a communication from the state health department has been that, again, that they're going to move Denver to level 3. But they are continuing to talk about, to some extent, what I just mentioned, that, are those things where we could maybe take a look at, those areas where there might be a little bit more flexibility for people to keep their mental health up and their physical health. They're having those conversations. And so, again, I don't want to get ahead of what they might be thinking there. As soon as we know how the state will address gyms, we will push that information out.
All right, thanks, Jesse. Ed, did you have a question? Go ahead, Vicente, with your follow-up.
Okay, thank you, Teresa. Mayor and Mr. McDonald, the restaurants in town have been saying that they feel like they're some of the safest places in town for crowds to gather because they follow COVID-19 regulations very closely, and they feel they're being unfairly targeted and that they should be allowed to have more people in them. Why have them reduce their capacity? And that's the first part of my question. And the second part is, will last call be made to be at 10 o'clock now as opposed to 11? Thank you.
So, Vicente, I'm glad you asked that question because I wanted to make a final point. You gave me the opportunity to do this. With just very few exceptions, I can tell you that our restaurants have done a phenomenal job. I, for one, as Bob pointed out, have continued to, meet people at restaurants, under the protocols, within the protocols, I should say. Every waiter, waitress I've had has had a mask on. Everyone walking around the restaurants wearing a mask. Protocols are being followed in terms of number of people at a table. We got to celebrate what our restaurants have done, and they are not targeted. I believe they are impacted by things out of their control, just like we all are, unfortunately, because there are, again, those individuals and groups of people who believe that who are not taking this seriously and are creating unfortunate situation of spread and putting us back, quite frankly, to level 2 or level 3, excuse me. And so, unfortunately, though not targeted, they're impacted as a result of it. But I want to say this very clearly: our restaurants, for the most part, we've had exceptions, and DDPHE has had to move in to correct that, with corrective action and citation to some extent, very minimally. But I can tell you what I've seen and what I've experienced and what others have experienced, our restaurants have followed the course and have done what's necessary to keep people safe when folks are in their facilities. Bob?
Yeah, I don't know that I have much to add. We've done, I believe, since the start of this journey with COVID-19, our department and many other partners, Department of Safety has been phenomenal. I want to thank Sheriff Diggins and Chief Payson helping us out, and Fire Department, of course, helping us out with our testing, but many departments helping out with this. But over the course of this, I believe we've done almost 20,000 visits of regulated facilities of all types, and a very, very small percentage of enforcement action has been taken against those venues. So again, largely compliant. There have been some situations where we had issued a summons, but we look at the number of visits that we've done. I think our regulated venues have done very well.
All right,
there was a
time for
final
one more
question on the last call. Do you have a comment on that?
Yeah, I'm sorry I missed that. Yeah, we will need to move into last call. That aligns with level 3, and I believe that's 10 p.m.
Thanks, Mayor. Sorry about that.
That's all right.
Any final questions? And you can always reach out to us also offline, either DDPHE or the mayor's office if you have any follow-ups. So thank you for joining us all.
If we can just say two last things. Again, this does not impact our ability to vote or anyone's ability to vote. We want to encourage you all to please share that information. And last but not least, and certainly as important, liquor stores remain open. Thank you all.